because we've got so much information for you, is to talk a little bit about the ACA, that Affordable Care Act, and what that means to you. Because if there was one reason to step up your point of service collections, it would have to be the ACA. As I've looked over the attendance list, I can tell that we have people from across the nation, wide variety of states, and that the impact of the ACA will be variable for you. One of the pieces that I included in your handout, and if you don't have it right now, you will, is a really, really wonderful 2-page agenda that was developed by the American Medical Association and the MGMA on a cooperative basis. So I think for many of you, this could be a valuable tool to use in your staff meeting to go over those key points, so that everybody from the front office staff through the healthcare providers and the billers understand what the issues are. Well, this slide illustrates one of the things that concerns me. It is supposed to be the Affordable Care plan, and this seems to look reasonable with a $256 a month premium. And I want you to look very carefully at that deductible. Primary care doctors, geez, $10 copay, that's pretty affordable. Specialists, that's $60. I have another one of these where the specialist copay is actually, for a visit, is actually $100. And in one of the meetings I was speaking at for dermatologists, one of the managers said, that's more than the visit would be for a level 2. Indeed it is. So I want you to make it a point to ask in your area of the plan what you're supposed to do when that copay exceeds the charge for the visit. Okay? And I also want everybody to look at this next slide. So no, there's no charge after the deductible is met for any of you, but it is a $6,000 deductible paid with all after-tax money. This patient, unless they're very, very sick, have some terrible chronic disease or some horrible accident, this person is going to be presenting in your office for allergy tests, for their pap smear, for potentially some rash that they got gardening, for their eye exam, and you are going to be responsible for collecting that whole fee. This was an amazing article that was in the New York Times on Saturday, and look at that headline, unable to meet the deductible or the doctor. If you need a full copy of this, this woman has had a very, very serious brain problem, should be monitored, but doesn't have the money to make that $6,000 deductible. So a lot of sad stories along those lines. So what do those headlines, what does that piece of legislation mean on the front line of your office? If you have downloaded your handout, if you would now join me in looking at page 6, which is one of the patient aging reports that is generated by AltaPoint. And as a consultant, one of the things that jumps out for me when I look at this page is that all of those $20, $10, $20 copays, and I only printed the last page of the report, $640 is over 120 days old. The practice has been billing these patients, which isn't for free. All of those small amounts could be collected. So it's very, very costly if we have a limp-wristed, weak effort and we are not in your practices collecting those copays at check-in. I also want you to notice, as I have, that second patient, Aisha Vinson, did pay $40 and that has not been posted against the charge. So this is an important message. If you do not routinely run your credit balance report at the end of every month, I'm going to encourage you to do that. You'll likely find that somebody forgot to enter a charge and match, but they did collect the payment. But it is a very good way to verify that the right things are being done at the check-in or checkout desk. If we look at your next page, this is your patient ledger. And again, we can see those credit balances that have not yet been applied. So we want to go through that again in a very careful way. All right? So your patient ledger report. I often find in working with practices that their software generates reports that, or useful tools that not everybody in the practice is aware of or is using fully. Now we go to the next report, and I want to make a significant point here. AltaPoint has the advantage of allowing you to run a patient AR report separate from the insurance aging report. I think that's valuable, it's important, and I'm going to encourage you, if you've been running one report that shows everything all mixed up, to try this methodology, because it gives you a much cleaner, easier way to work your accounts receivables. And if you can run that insurance aging report by carrier so that you have all the Medicare patients on 1, 2, 3, 4, 5 pages, all the Blue Cross Blue Shield, it's going to make planning your follow-up very, very efficiently. You won't sit on hold for 10 minutes potentially, only to discover that on the next page when you flip there was another account that you would have liked to have asked about. Important note here, the tools that Betty Amos, my co-presenter, is going to show you, if you used them, these reports would be cleaner, easier, and you'd have a lot less work to do. So we're going to talk about moving follow-up to front-up kind of work. Well, another advantage that I'm hoping you take, that you've implemented in your practice, is the patient portal. And I've asked Ty some questions, and can the practice use the portal if they don't use the AltaPoint EMR? And the answer is no. And believe me, the portal, which is called Z Patient, which I appreciate, unfortunately is not named for me, but I am 100% enthusiastic about the notion of patient portals. If you are using the practice management system in the EHR and you are EMR and you are not currently using the portal, it is well worth the money, okay? So please, please, please look into the patient portal. One of the reasons for you to do that is it takes work that is currently being done by your front desk staff, and it relocates that, and the patient is doing it themselves, and then they are just verifying, staff are verifying at check-in that they filled everything out. We are the world's biggest fans of pre-registration. We've been preaching pre-registration now for over a decade. I don't understand why any practice would not want to know if my insurance card was good, what my benefits are, to what extent I've met my deductible. If you're seeing me for the first time, I have no established credit record. You don't know if the card's good then until you submit that bill. And for most of you, think about this. That first visit is a very expensive one. It involved a visit and a biopsy. It involved a visit and some testing. So really, really important that you turn your head around on this. I am not Pollyanna, and I don't think that you are ever, I'd like you to, but I don't honestly think you're ever going to register 100% of all your new patients. But gosh, I know that there would be extraordinary benefits if you were to register 25%, between 25 and 50% of those patients, and Betty is going to show you how. If you're not using the portal, we can call patients back and get the pertinent information. Many of our practices, more than a decade ago, were using their website. They would have patients download the registration forms, the health history, and fax over those forms and a copy of their benefit form. If you're one of the practices that has the luxury of booking far, far out, then you might have people mail it in. Other offices have patients fill out that registration data while they're sitting in the reception room, on a tablet. And I suspect some of you may be using that methodology. And patient re-registration is equally important. When I was at a dermatology practice recently, the doctor totally flipped out when he saw that the patient had a $700 previous balance, and the patient announced he was moving to Southern California from here in Chicago. So that re-registration effort, it turned out that they had been sending the bills out but to a wrong address. So unemployment is currently at 5.9%. It's dropped. People are getting jobs. They may have non-existent health benefits or different health benefits. And very importantly, 10,000 of us will be turning 65 every single day for the next 18 years. So you're going to have a lot of people moving to Medicare. Anytime at your front desk, if you are currently not scanning benefit cards into AltaPoint, you need to be doing that. And I want you to be sure for all new patients that you are asking people for a piece of government-issued ID. And if you think that this sounds a little airportish, TSA-ish, well, maybe it is. But we need to be sure that the person presenting that insurance card is indeed the insured individual, and that somebody hasn't well-meaningly but incorrectly loaned their card to somebody. So here's my card being scanned into a system, small footprint scanner attached right to her keyboard. And here is an example of one of these guys. Is he or isn't he Medicare eligible? And the answer is he's not, but he looks like he might be. Okay? So patient re-registration. Here's examples from practices around the country. Texas Ear, Nose, and Throat Specialist has a wonderful website and very robust use of their secure patient portal. Okay? Town and Country Pediatrics, so it's specialty and primary care practices that are doing this, and you can see in the center of the screen there is a new patient tab. Alrighty, new patient tab. Alrighty. I think one of the things that has caused many of the practices we work with a giant headache are these so-called Medicare Advantage plans. And although they are mandated to provide the same benefits, they do not provide the same payments. So, and also legislatively, they are allowed, unlike normal Medicare Part B plans, they don't have to pay you in the 13-day window. They have something like 45 days. So I really think that the notion, which Betty is going to discuss in detail, I just want to highlight the real importance of verification of eligibility and benefits before that patient gets in your office. And many people aren't aware of this, but one of the real benefits in the ACA Act is that all health plans were to be able to provide you with this information within the 20 seconds. Now, one of the key questions we want everybody to ask, and I'm so happy that AltaPoint is paired with Availity, which we consider to be one of the most friendly clearinghouses with a robust series of services. They just really, really do a great job. And again, we find so many people who are unaware of the vast array of services and reports and tools that their clearinghouse can provide, and particularly Availity. So I want to be sure to put this question top of mind. And here's a couple of examples of their RealMed solution. Again, the group using RealMed significantly was able to reduce their paper claim rate by 30%, reduce phone calls, and all of you know that when you call, you're going to spend more time on hold than you are talking to anybody. That is for sure. And I think that 25% reduction in claim denials, again, eliminates all that needless, icky rework. So please take a look at those numbers. A service that we are very, very enthusiastic about are claim estimators. Any of you who are in procedural or surgical specialists, if you are not using this tool, boy, oh boy, and Availity, you are missing a huge way to improve revenue. Anybody listening on this call who'd like a raise, you get on that claim estimator, you are going to be able to show your doctors a real and immediate uptick in revenue. So through the Availity.com, you've got a single source sign-on because they have partnered with Aetna, Cigna, and the Blues plans in most states. So you don't have to remember a separate user and password number. That is a big plus. United Healthcare remains sort of stubbornly independent, and you will have to have a unique ID to look there for your claim estimator. Well, I thought I would show you this because I think it's a wonderful example. You may disagree with the fees, that's not my point, but our surgical coordinator in this ENT practice puts in the necessary information, the patient information, their ID, yada, 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 and this is all done in a matter of seconds. Far better. Please listen to me because I have people who say, oh, we get all this on the phone. Get off the phone. Use the computer. Plus, on the phone, the patient didn't hear what the person at the plan said. You want to be able to print out a piece that looks just like the claim estimator on page 12 that has the Cigna logo plain on it. And it has this most excellent box, which doesn't happen if you're on a phone call, that says the member owes $347. Collect payment. You are giving that to your patient covered by this Cigna plan, and you're going to ask for the $347 or a surge. If you think that you look what the patient does, you say, well, they wouldn't have that whole amount of money. We will ask for a surgical scheduling deposit, and then we will use another methodology to collect the balance. But it certainly to us makes abundant good sense to begin that collection process before we begin the delivery of expensive services. I will always remember the orthopedic surgeon who said, well, if patients knew how much they were going to owe, they wouldn't have anything done. Now, I want you to think about the circuitous logic in that physician's statement. I think these statistics should be sufficiently persuasive about why we think this is important. There are 16 million new patients via healthcare reform deemed high risk to pay. So the problem, and people say, oh, we get a promise to pay. Well, you know, I've been doing this work. I've been in practices for 30 years. And I know that promises to pay are like pie crusts, and they're most often broken. So there are a lot of problems with this particular notion. One, somebody's got to follow up and see if the patients kept their promises, right? And you don't have any time to do that. You're trying to get the current bills out. You've got all those reworks to call. You've got a potential solution here in terms of setting up recurring payments. And Bill Flash is going to be able to talk with you about that. That comes on tomorrow's call. Patients who fail to keep their promises, right? Look at this guy. He just lost his job. He just decided he needed a new iPhone. He needed a new iPhone for $695, and thus he's not paying you. Once again, those recurring payment plans are an excellent solution. Problem 3 is that the software often doesn't make it easy to see who is on a plan or who paid. I was so happy when Ty told me that, in fact, there is a separate good place for you to do this in AltaPoint, that you can group all your patients on a payment plan, who are on payment plans. So there's a custom report. If you're not using that, you're going to want to implement that. Well, recurring payment plans are exactly how you pay your gym. If you've got a storage facility, I pay my church this way. They don't, I guess they care if I'm not there on Sunday morning, but in any case, they do get paid. So there's an automatic charge on my credit card. So you're going to hear more about this tomorrow when Michael Bennett talks with you from Bill Flash. And there are some other ways to implement recurring payment. So some of your patients have debit cards. Some of your patients, I want you to look to the far right, have HSAs, those health savings accounts. I have one of those. I have something that looks like a Visa card that I could give you, and I could agree that you could hit that up for $50 or $100 a month, okay? So there's lots of ways to do this. I want to make the point that if you are doing it the old-fashioned way, if you are doing your promises to pay and hoping that these large balances will get settled by the patient receiving a monthly bill, which is the way we did it in the 70s and 80s, I admire your optimism, but I want to caution you, it is unfounded. So it is my pleasure to turn things over to Betty Amos. I've had such a good experience working with Betty, and I'm thrilled that she is able to share with you her experience in working with physician practices on improving their revenue cycle for over 15 years. Betty, take it away.
Hey Betty, this is Ty. We can see your screen, but we can't hear you. I'm talking to Betty on the chat. She said she's trying to unmute her phone. Just one moment. Bear with us.
Hello. Hi, can you hear me?
Yes, we can hear you now, Betty. There you go. Whatever you did, it's working. Go ahead.
Okay. Well, I was just talking away. Um, so thanks for taking time to learn about the Availity RCM and AltaPoint integration. I do want to divert from my presentation for just a minute and speak to a couple of things from a patient level in regards to what Karen shared. I'm a patient who wants to pay my bills on time. I have a lot of bills for my son who has some medical issues, and The last person that gets paid is the person who sends me a letter with no website for me to go to or no reoccurring payment plans. Not because I don't want to pay, but because it's quicker and easier for me as a working mother to put a credit card into a website or set up a payment plan and know that it's going to come out of my account every month. So I did have to share that with you. I'm 100% in agreement with what Karen had shared about making those options available and minimizing the resources used in your practice. So as we go through the presentation today, I want to talk with you about how technology can increase your revenue. We're going to talk a little bit about our integration with AltaPoint with real-time eligibility, real-time claim editing, automated secondaries, and then share with you a little bit about our clearinghouse services that we have available. So why check eligibility? In today's world, it's real important that you utilize technology to check eligibility. It's going to increase your collections by eliminating any uncollectible revenue from patients and minimize the insufficient insurance data that you have in your system. With the AltaPoint integration, you can actually verify at patient registration. You can use, sorry, I was minimizing my dashboard. You can utilize from the patient's account or from the insurance screen. And these benefits are going to come right back into your screen in about 8 seconds. So all you're going to do is go to your patient's insurance account, hit eligibility, and literally in 8 seconds, you're going to see come back in all of their benefit information. So it's going to give you patient information, subscriber information, and then policy dates, and then it'll give you a breakdown of actual benefits, copays, deductibles. So that's going to go right back into your AltaPoint system. That will reduce the number of times that you're sitting on the phone calling for coverage on your patients. The next piece of integration that is huge is we have opened up our clearinghouse edits to the AltaPoint system. So the way it will work is while you're in your AltaPoint system posting your charges, you have an opportunity right then to click a button. It's going to send that claim through all of the clearinghouse edits and come right back into AltaPoint. So as you're working through each charge that you're posting, you're actually going to ensure that it's going to pass all of your clearinghouse level edits before you even send that batch of claims to the clearinghouse. So this is a big piece of integration, and AltaPoint is one of the first vendors that we actually have this integration with. So the customers for AltaPoint have an added benefit that most of our vendors do not have. One of the things that we will also do when we pass back any kind of response to you is typically when you're sending claims to a clearinghouse, you're getting back language that is in an ANSI format. Hey, your loop and segment is incorrect. Well, we don't speak in loops and segments. We translate that and we say, hey, your diagnosis code is invalid. You need to enter a correct diagnosis code. So we're going to translate all of the ANSI jargon into language that makes sense, and that's actually going to speed up your processing time because you're not having to research what those issues are. The next piece of integration that we have built with AltaPoint, which is huge, for AltaPoint customers, we have actually developed automated secondaries. And so what that means to you as a customer is instead of manually printing a claim in your office, matching up the EOBs that you printed, putting them in an envelope, putting a stamp, and mailing them, we're actually going to speed up time to payment on these because we're going to allow you to send them electronically. So the 45-day payment window that you did have before is now reduced to about 14 days. What we do is we're going to, when you send a primary claim, has a secondary insurance on it, we're automatically going to convert that to a secondary claim when you receive primary payment, and we will send those out to the payers with the EOBs attached. So that's going to remove or eliminate a lot of the secondary work that you're doing in your office. We currently have 90% of all of our AltaPoint clients taking advantage of this. The other 10% either send minimal number of secondaries, or it's an opportunity for us to go and get them signed up on our auto secondary process. And then finally, with our AltaPoint relationship, it's not exclusive to checking eligibility or having the claim editing or auto secondaries. We actually have the whole library of services that you see on my screen right now. This is what you're going to get as an AltaPoint customer. You're going to have eligibility, which is real-time posted back into AltaPoint. We also have it interactive in our portal for those of you who want to use that. We're going to be able to send your primary and secondary, tertiary claims electronically. We will send your drop-to-paper claims. We have the automated secondary process, our edit error where we're going to scrub your claims, and an added benefit of our claim scrubbing is we're also going to do an additional eligibility check prior to claim submission to make sure what's on the header of your claim matches what's in that payer system, which will reduce back-end denials for patient not found, can ID patient. So that's going to be a huge piece of our editing. You can check claim status, you can receive remittance advice. Those remittance advice can be auto-posted back into AltaPoint, again, saving you more time and resources. And then we have a reporting library and all training and support. All of our training and support is based out of Indianapolis, Indiana, and each practice will have a dedicated client account manager that will be able to assist you and work with you on training and any support matters that you have. And then our contact information for our services, you can either reach out to myself or to AltaPoint Direct. Either one of us can work with you to get you set up and going on the RCM solution and work with you on the clearinghouse integration with AltaPoint.